Welcome to the exercise classroom, anatomical, biomechanical and practical exercise education. Today's lesson, pull-up. Introduction. The pull-up is a compound upper body exercise performed by pulling the body upward toward an overhead bar. It primarily develops the muscles of the back and elbow flexors while requiring coordinated movement and stabilization of the shoulders, scapulae, trunk, and upper extremities. Body contour benefits. The pull-up helps develop the latissimus dorsi and other muscles of the upper back, contributing to greater back width and upper body definition. It also strengthens the biceps and other elbow flexors, supporting balanced muscular development of the arms and back. The movement. Joint action. The pull-up primarily involves shoulder adduction and elbow flexion as the body is pulled toward the bar, accompanied by scapular downward rotation and retraction. These actions reverse during the controlled lowering phase. Functional benefits. These coordinated actions develop upper body pulling strength that supports climbing, pulling, lifting, and other activities requiring the body or an external resistance to be pulled toward the arms. Exercise execution. Starting position. Grasp the overhead bar with a pronated grip slightly wider than shoulder width. Allow the arms to extend while maintaining a stable shoulder position and controlled trunk. Movement. Pull the body upward by drawing the upper arms toward the sides and bending the elbows. Keep the trunk stable and avoid excessive swinging or momentum. Ending position. Continue upward until the chin reaches or passes the bar. Lower the body under control until the arms return to the starting position. Proper technique. Use a secure overhand grip and maintain controlled shoulder and trunk alignment throughout the exercise. Range of motion. Pull until the chin reaches or passes the bar, then lower under control until the arms are extended without losing shoulder stability. Common mistake. Swinging or kicking the legs to generate momentum reduces muscular control and can place unnecessary stress on the shoulders. Keep the trunk stable and perform the pull-up with a smooth, controlled motion. Muscle mechanics. The latissimus dorsi produces shoulder adduction as the body is pulled toward the bar, while the biceps brachii, brachialis, and brachioradialis contribute to elbow flexion. The trapezius, rhomboids, and other scapular muscles control the position and movement of the shoulder blades, while the trunk muscles stabilize the body throughout the exercise. Primary movers. The latissimus dorsi is the primary mover at the shoulder, producing shoulder adduction as the body is pulled upward. The biceps brachii, brachialis, and brachioradialis contribute to elbow flexion, working together to bend the elbows and assist in raising the body toward the bar. Other muscle roles. Antagonists. The deltoid, particularly the middle fibers, and triceps brachii oppose the primary shoulder adduction and elbow flexion actions of the pull-up. Synergists. The teres major assists the latissimus dorsi with shoulder adduction, while the biceps brachii, brachialis, and brachioradialis work together to produce elbow flexion. Stabilizers. The trapezius, rhomboids, rotator cuff, and core musculature help stabilize the scapulae, shoulder joints, and trunk throughout the movement. Biomechanical considerations. Grip width. A slightly wider than shoulder width grip allows effective shoulder adduction while maintaining a comfortable and controlled shoulder position. Body position. Keeping the trunk stable limits unnecessary swinging and helps direct muscular effort toward the back and elbow flexors. Scapular control. Controlled movement of the scapulae supports efficient shoulder mechanics and provides a stable base for the pulling motion. Movement speed. A controlled tempo, particularly during the lowering phase, maintains muscular tension and reduces reliance on momentum. Training effectiveness and optimization. Full range of motion. Using a controlled full range of motion increases muscular involvement and develops strength throughout the pull-up movement. Progressive overload. Increase difficulty gradually by adding repetitions, slowing the movement, or eventually adding external resistance as strength improves. Controlled eccentric phase. Lowering the body slowly increases muscular tension and can help develop the strength needed for improved pull-up performance. Exercise progression. Assisted pull-ups and controlled negatives can help develop the strength and technique necessary to progress toward unassisted pull-ups. Safety and injury prevention. Shoulder position. Maintain controlled shoulder and scapular positioning throughout the movement to reduce unnecessary stress on the shoulder joint. Avoid excessive momentum. Swinging, kicking, or jerking the body can increase stress on the shoulders and elbows and reduce muscular control. Controlled lowering. Lower the body smoothly rather than dropping rapidly into the bottom position, which can place excessive stress on the shoulders. Appropriate progression. Use assistance or reduced volume when necessary and progress gradually as pulling strength and movement control improve. Variations and alternatives. Lat pull-down provides a similar vertical pulling pattern while allowing the resistance to be adjusted, making it useful for developing the strength needed for pull-ups. Chin up uses a supinated grip and emphasizes the elbow flexors, particularly the biceps brachii, more than the traditional overhand pull-up. Assisted pull-up reduces the amount of body weight being lifted, allowing the pull-up movement pattern to be practiced with greater control. Seated row uses a horizontal rather than vertical pulling pattern while strengthening many of the same back and elbow flexor muscles involved in the pull-up. The pull-up is a demanding compound exercise that requires coordinated movement of the shoulders, elbows, scapulae, and trunk. Understanding the anatomy, joint actions, muscle roles, and proper technique behind the movement helps you perform the exercise more effectively, make informed training decisions, and reduce unnecessary injury risk.